helping. Okay, I'm being recorded now. So our leadership group has done workshops like this. Oh gosh, I bet for the last 10 years, Josh, you think, maybe 15? Mm-hmm. It always seems to be a popular thing, and people tell us that they get a lot out of it. It's casual. When we're in person, you know, we stop and answer questions along our presentations, and we hope you'll do that, or at the end of each quick little presentation, hold your questions to the end. But we're here as a leadership group to help our team captains help build their teams stronger and better, and bring ideas to the fundraising table. So that's what we're going to do tonight. And we'll just briefly go over the agenda. Tonight, we're going to learn, if you're not familiar with what the AIDS Service Foundation is, we will hit the mission on that again. We're going to have a presentation on stats and stigma. And we're also going to be able to show you where some of that money out there that we hope that you can raise, you and your team members. And then we hope to share some fundraising ideas with you that might help. And then we're going to have a testimonial here at the beginning. Actually, the agenda reflects that towards the end. But I'm going to do the agenda now. I'm going to ask our president of the AIDS Service Foundation to say a few words, and then I'll introduce that testimonial.
Awesome, thanks, Michael. Happy Tuesday evening, everybody. My name is Ryan Gove, and I am the current president of the AIDS Service Foundation board. And I wanted to thank you for being here, because you're doing the work that helps us raise money and awareness for HIV/AIDS in Kansas City. I think the most important thing is that we are back in person this year, which is our 110% goal. We're going to keep pushing towards that. So we're going to have a ton of people excited about being there, excited about raising money, excited about just getting back involved. And I think it's important to remember and talk about where the money goes. So as a foundation, as a board, we just distributed $30,000, $10,000 each to our 3 primary recipients, Hope Care Center, Casey Care Health Center, and Save Inc. And then we also, Kimberly, who'll speak in a second, our Vice President for Education and Outreach, and her committee just distributed more than $75,000 in community grants to 11 local organizations. Many we worked with for a number of years, like the Calvary Community Outreach Network and the Coterie Theater. But we were also excited to bring in new organizations like Barrier Babes and First Call. So we have our primary recipients. We also have a lot of money going into our community grants fund to help smaller organizations. And really our goal is to be out there across the city, raising money, raising awareness. And we continue to be honored to say that every penny raised stays here in Kansas City. That is one of those things that you can tell every person on your team, to tell every person that they're giving a donation, that everything stays right here in Kansas City. So I just wanted to hop in, say thank you. Thank you for the work you're doing. Thank you for helping us fight the good fight against HIV/AIDS in Kansas City. And I'll turn it back over to Michael.
Great. Well, thank you. And before I introduce our testimonial, just to remind everybody what the AIDS Service Foundation is, and just read the mission statement right here. And our mission is to raise money to support the Kansas City metropolitan HIV/AIDS community while raising awareness about HIV. It doesn't get much simpler than that. That has always been the calling of the foundation since its founding more than 30 years ago. And I think that we stay true through our events, everything that we do, the mission statement is right front and center. So we appreciate, again, you joining us in this. I think what I'll do, I'll come back to our AIDS Service Foundation events. Well, I'll just go over them real quick since they're up there. We raise money in a lot of different ways, and the two major umbrellas are our AIDS Walk, of course, that you're participating in this year, obviously. And then in December, always December 1st, we have World AIDS Day observances around that day. And the walk includes lots of smaller events. We have a really strong effort in event fundraising. Everything from our development committee chair, Angela Durrell, has made raising bingo on Zoom a really artwork. And so the last 2 years we've done that and do trivia. And then, as you all saw, probably our AIDS Walk Open this year had to be postponed, and we're still working on a date to bring that popular and a very successful fundraising event back to life here sometime, hopefully later this year. Then, of course, Walk Day is coming up around the corner on April 30th, Saturday morning. As always, registration with Brian Partlow and his team opening up at 8 a.m. And we do our program between 9 and 10, and then we walk, of course, right at 10 o'clock sharp. We will have a house party, which is always a major fundraiser sometime later in the cycle. We don't have a date on that. And as we go through the cycle, other fundraisers will pop up, and Josh will be good about sending out email blasts and so on and so forth. Our social media committee will also get word out to you all about those things. All right. Well, I am really thrilled that a longtime friend of AIDS Walk, and he's very young, but he's been a longtime friend. We've asked just to give his reason why he walks. And it's a real pleasure from the Heartland Men's Chorus team to introduce you all to our dear friend, Randy Height.
Hey, everyone. Thank you, Michael. I'm honored to be a part of your meeting this evening and talk about why I walk. As Michael mentioned, I am a part of the Heartland Men's Chorus team, and we've had a team walking for several years. And when I thought about it, why do I walk? How would I put it into words? The first idea that came to me was, well, you know, I'm young enough, Michael, that I lived through the 80s and the 90s. And so, like many of you, I had friends that died from AIDS. So to me, it's a time to remember them, to honor that part of our history, and just to never forget what that time was like. So that's probably up there, one of the strongest reasons. You know, I've often wondered why was I spared? You know, I remember how nervous I was the very first AIDS test I got, HIV test, and so I don't know why I didn't go the way some of my friends did, but the least I can do at this point in my life is to remember those people and to honor them by walking an AIDS walk. And the second reason why I raised money is because there's still a need for the services. There's still a need for testing, for PrEP. I know several people that are living with HIV, so it's still in my world. It's still in my consciousness. And so that's why I raise money, continuing not only to remember, but to help with the situation now. And I would say the third reason that I walk is what I mentioned earlier, that I'm a part of the Heartland Men's Chorus team. And so for us, I've been a part of the Heartland Men's Chorus forever. Some of you might know my husband, Rick Fisher, is the executive director of the chorus. The chorus has been part of our lives for so many years and is so important to us. And it's important, not only do we want people to support us and the chorus and the work that we do, but we want to support the community. So it's our way of giving back to the community. And I would say if you're part of any organization or small business or anything, one of the things that you can do is to give back. And the AIDS Walk is a perfect way we can get the chorus involved and give back to our community. That's an important part of the chorus, is knowing that we are not only asking for support, but we are giving something back to the community. So that's the third reason that I would say that I walk. So that's all the reasons I walk. I do it every year. It's kind of marks my calendar. You know, this is what I do this time of year. So so many great people involved. So
And
that's
we
it.
so much appreciate your continued support and being with us, Randy. And your team comes out in heck of great numbers and often helps entertain before the event itself. So, well, thank you so much for being here. And Randy's off to choir practice, I think.
I am in just a few minutes. I'm going to hang around just to hear some of your good words.
Okay, all right. Well, thanks again. The AIDS Service Foundation has 3 primary recipients of the funds that you all are out raising money for this year: Hope Care Center, Save Inc., and KC Care Health Center. And then we also fund what Ryan had referred to earlier from Kimberly's committee, our community grants. And as he said, very impressive numbers given recently, $70,000 worth of grants into our community from the good work that team captains and walkers have been raising from last year. Okay, Josh.
Sorry, we skipped over that slide earlier, so I had to go back.
Yeah, that's okay.
Now we're up for, oh, this thing is touchy. There we go.
There we are. And it's my turn to introduce you to Kimberly Carlson, who's the Vice President of the AIDS Service Foundation Board of Education. So, Board of Education, that's the thing. Vice President of Education. So Kimberly.
Hi, good evening, everyone. Thank you for being here and taking time to learn about HIV and AIDS in our community and more about AIDS Walk. We really appreciate all that you are doing. So I'm here to give you an overview of the current state of HIV in Kansas City and also the science and health innovations as it relates to the health of people at risk and living with HIV. So in Kansas City, currently there's about 5,700 people living with HIV in our 11 county metropolitan area. The infection rates for Kansas City are on the rise for Black males, minority females, and young adults from ages 13 to 24. So we'll look at a couple statistics slides from the health department. Oh no, here's a little national snapshot. So nearly 1.2 million persons in the United States are living with HIV, but 1 in 8 persons is not aware of their status, and that is because they have not been tested and they did not believe that they are at risk possibly. So we'll be touching on reasons why people don't get tested and why everybody should know their status. Young people were most likely to be unaware of their infection, with people aged 13 to 24. An estimated 51% of them did not know that they were living with HIV. So here's a couple of snapshots of what is going on in our metro area. This data is from 2019. It usually takes about a year for the health department to analyze the data and get it updated, but it has not been updated for some time, to my knowledge, due to the impact of the COVID-19 pandemic, which has taken a priority for good reason at the health department. So we'll be looking forward to updated numbers. They are capturing the data, but just not putting the analysis out. So we await new numbers going forward. But as you can see here, Jackson County had 108 cases in 2019. Clay County had 21 new cases. Platte County had 12 cases. Cass 8. No new cases in Ray or Clinton County. Lafayette had 3 for a total of 152. Now, this might sound like a small number, or even maybe the 5,700 people living with HIV in our community compared to larger cities, but I always am thinking about the actual people that I'm trying to help in the fight against HIV/AIDS. So these are actual people with families, with jobs, and even though the number might seem small in comparison to other cities, we have the tools and technology to prevent new infections right now And so even one new case is more than we want to be occurring. Here you can see cases by sex, looking at males and race, how they have changed over the years. So in 2017, 52 new cases in white men, 36 in black men, and 14 in Hispanic men, and not much change throughout the years, you can see. So what we want to be seeing is decreases every single year. And here is a snapshot of age of HIV diagnosis for males in 2015 through 2019. So again, you'll see the highest new case rates are in those youth age 13 to 29 with the red bar. And then the same for females. So looking here, we're seeing that the highest rates for new infections in females are 25 to 44 with a green box throughout the years. All right, so this is something that I think is important to talk about because our walk theme is always a walk to stop stigma. And I hope all of you have seen our amazing New World AIDS Day mural that is down at 18th and Walnut in the Crossroads, which also has a theme of stigma as a public health, basically like emergency and how. So we'll be talking about some of the current innovations in HIV and how they can prevent new infections, and then how this relates to stigma. So we have tools right now that are generally referred to as treatment as prevention or biomedical interventions to end the HIV epidemic. The problem is a lot of people don't know about these tools and innovations and advances that have occurred over the past decade. So we have HIV treatment medications, which have been around for a while, but have greatly evolved. A lot of them are one-pill regimens to help improve and extend the quality of life for persons living with HIV. We also have pre-exposure prophylaxis, which is called PrEP, and post-exposure prophylaxis. We'll be talking about what these are in the next couple of slides. And then there's absolutely conclusive evidence that if a person is taking their HIV treatment medication as directed, and they do not have detectable virus in their blood, that they cannot pass on the HIV virus sexually to another partner. This is referred to as undetectable equals untransmittable, or U equals U. So we'll go into a little bit more detail about these. So pre-exposure prophylaxis, or PrEP, is a daily pill or monthly injection to prevent HIV. So PrEP as a pill has been around for quite a few years now, but only in December of 2021 was the injection version approved by the FDA. So that you can take an injection every 2 months to prevent HIV infection. And same thing for PrEP, you can take a daily pill once a day, if you so choose, to prevent HIV infection. This is amazing. I mean, these are well more than like 99% effective at preventing HIV. But the problem is a lot of people don't know that these treatment as prevention options exist. There's a lot of racial disparities about who knows about these and who is using these medications. So white men who have sex with men are the most common users of PrEP, but that is not who is most, where we're seeing most of the new infections. So African Americans and Latinx are less likely to know about PrEP or be PrEP users. A lot of my previous work was about women and how women also don't know about these options. And this is actually a concept that women are very used to. It's like the birth control pill. If you feel that you're at a time in your life where you want to protect yourself by this option, by taking one pill a day and taking control of your prevention and your preventive health, then you can have this as an option. It's not something you have to take forever if you don't want to. Depending on your lifestyle, this may be good for you to take right now. So women, we did a lot of research and showed that women were actually very upset that, you know, their family planning providers have never brought this up to them because it's a concept they're very used to.
Wow,
So-
I didn't know 1 in 5 new HIV diagnoses are women.
Mm-hmm. So we really need to get more the word out about PrEP and make it available to everyone. There are a lot of medication programs where you can get the medication for free or low cost. But there's also stigma that exists about people who take this. So there's been terminology about PrEP whores. Like if people are taking PrEP, they must be being promiscuous. They should actually be being applauded for taking steps to prevent and protect themselves and taking the initiative to do that. And it's their choice. If they want to take PrEP and not use a condom, this is a very, very effective way to have a healthy sexual life. So PrEP uptake is increasing, and we are seeing a decrease nationally in relation to that. And we'll be looking at those trends as we go forward nationally. So another option is called PEP, or post-exposure prophylaxis. This is if you have a possible exposure, which could really be having condomless sex with somebody who you don't know their HIV status. Simple as that. You don't know. That could be a possible exposure. You can take medication within 72 hours of infection. Now that 72 hours is really important to prevent or reduce the chance of infection. And we had some really important legislation passed last year with a bill introduced by Senator Greg Razor, SB 72, that now allows pharmacists to dispense PEP medication in Missouri. So this is another option. And then finally, this is something that is so important and really important to stigma as well, that a lot of people don't know. So I mentioned it earlier, it's called U equals U, or undetectable means untransmittable. But people living with HIV who are taking their HIV medication as directed and therefore do not have detectable virus in their blood, meaning they take a blood test looking for the HIV virus and their virus levels are below the level of detection. They do not transmit the virus sexually to partners. Absolutely zero risk, no risk. This concept has been studied throughout the globe. There has never been a transmission that has been noted in any of the studies. And the CDC, the National Institutes of Health, the World Health Organization, everyone has embraced and endorsed this concept in the past 5 years. And this has really been a game changer. Now, why has this been a game changer? There are some people that have had undetectable viral load who are HIV positive for 20 years. And they've been walking around thinking that they are infectious, that they cannot have a normal, sexual life because they could possibly infect someone else. And there's always that risk in the back of their mind. But what the science says is that is actually not possible. So all of these clinical studies have looked at that. So therefore, they can feel better themselves and hopefully reduce the internal stigma related to having HIV. And then also this helps with public health because if you are taking your medication as directed, you're also not passing on the virus to another person. So a lot of implications as it relates to stigma, both internal and external. This concept is also really relevant to HIV criminalization laws, of which lots of states throughout the United States still have very old criminalization laws. If a person who has HIV could be convicted in certain states if they possibly exposed somebody to HIV, meaning they had sex without a condom with another person. That person could report them and they could be jailed for decades because of these old laws. But what the science says is if they're undetectable, there's no way for them to be actually even transmitting the virus. So it's a newer concept, but it's something that people are not aware of. And it's really important to know the science and the evidence and how it impacts stigma. So what is HIV stigma in general? I mean, in general, stigma is based on fear. So it's having negative attitudes about persons who might have HIV. So certain examples here are believing that only certain groups of people can get HIV. I think there's a stereotype that it's, predominantly white gay men are the most at risk, but the national data is telling us that that is not where we're seeing the new infections again. There is moral judgments about people who take steps to prevent HIV infection. So again, using PrEP and not using condoms. To some people, it's really scary to think that people are taking PrEP and not using a condom, where again, the science and the evidence does not align with that. And then people thinking that people deserve to get HIV because of the choices that they made, which is again, not true. So the stigma has not caught up with the science yet. People with HIV are surviving and really thriving in their lives. If they're taking their medication as directed, they have a normal life expectancy now. It's not like decades ago when this first started and life expectancy was greatly reduced. So it's no longer a death sentence. We have the tools that I talked about to prevent new infections. And I also wanted to note about terminology. If you're talking about HIV, it's encouraged to use person first terminology, like people living with HIV, rather than terms like infected, which have a more derogatory connotation. So what can you do to take action against stigma is talk about HIV and prevention options, let people know, like, wow, I found out this really interesting information on, from the AIDS Walk training, and let people know, spread the word. And then also normalizing HIV testing. When Randy mentioned getting his first HIV test, it took me back to getting my first HIV test and how I had a panic attack. And it was at the time where you had to wait 2 weeks to get those results, and the entire 2 weeks not knowing and thinking it could be positive, but knowing is what's important. Not knowing is not helping anyone. So I really like this quote from Dr. Carrie Foote at 2019 conference on retrovirus and opportunistic infections. She says, all people living with HIV have a right to accurate information about their social, sexual, and reproductive health. Stigma is killing us by not talking about these issues. So HIV stigma is a public health emergency, and U equals U is an immediate effective response to begin to dismantle this stigma. So why don't people get tested for HIV? They could be scared and fearful of what those results might be because there is a lot of existing stigma related to HIV. Doctors and healthcare providers don't suggest or offer it as testing. A doctor has never offered me an HIV test in my life because I'm a white appearing heterosexual woman who was formerly married. And I don't know if they think that I'm not at risk, but I have had to ask for an HIV test every time. And I encourage my friends as well to ask. If you're doing an STD panel, they don't automatically ask you to include HIV. Is not usually included in that. So a lot of times you have to ask. And then this helps normalize it with the physicians and clinicians as well to say, oh, well, they want this, and this is part of the testing that they want. So hopefully it goes both ways to normalize the behavior. Some persons have lack of access to healthcare. Of course, there are free HIV testing sites all throughout the locality and the country as well. There's insufficient sexual health knowledge. Absolutely. I used to teach human sexuality for quite a few years, and that's something that trying to remedy, especially as it relates to healthcare. And then a lot of people don't think that it could happen to them, that they don't fit the risk profile or the stereotypes of who people think are actually the ones who are living with HIV. So the national government is always looking at the HIV care continuum here, which is diagnosis. How many people in the United States with HIV are diagnosed, so know they have HIV, are linked to care, meaning that they're seeing a doctor on a regular basis, a social worker if they need assistance, etc., that they continue to stay in care, that they're prescribed medication treatment, and that their virus is not at a level that can be detected. But what is left out of that a lot of times is what happens before people get diagnosed. So all of these things that we're looking at here, racism, poverty, homophobia, misogyny, all of these things have to be addressed to get people even in the door to get an HIV diagnosis. So it's thinking about these social issues when we're talking about public health. So again, I encourage everyone to know what your HIV status is. Of the more than 1 million people in the US who have HIV, about 13% did not know that they have it. And the only way to know is to get tested. The test doesn't take that long like it used to in the old days. The actual national recommendations are that every single person aged 13 to 64 should be tested at least once. And people at higher risk should be tested at least once a year. And it's up to you and your physician to determine if you might be at higher risk. So ask your clinician for an HIV test at your next annual physical. This should be something that they should be offering anyways. Or you can click on this website to find where the testing centers are in your city. Now, we're not going to go through all of these statistics here, but just wanted to touch on the significant disparities that we see in HIV infection, racial and ethnic disparities. So the populations that are being disproportionately affected by HIV and AIDS are Black and Latino persons primarily, as it relates to new infection rates and health outcomes after diagnosis as well, and AIDS diagnoses. As it relates to women, women are increasingly, about 22% of all persons with HIV, and younger persons as well, as we saw with the local statistics, are mirrored nationally as well, with 50%, those under age 35 accounting for 57% of new HIV diagnoses. So lots of room for improvement as it relates to HIV disparities.
Right. Well, Kimberly, thank you, and thank you for putting those slides together, and you're so knowledgeable and articulate. We appreciate you being a part of this tonight.
Absolutely. Thank you all for listening, and thanks for all that you do with AIDS Black.
All right. And just a quick reminder, all those statistics and stuff are in the chat room, right, Josh? Can they still access?
Yeah, actually, so in the chat is a link to the actual slides for tonight, but also you can find them on the AIDS Walk website under the Download Center. Just look for the Team Captain Packet area and you'll see a link to the fundraising workshop for this evening. So you'll have all those helpful stats that Kimberly just shared.
Great, great. And now do we introduce our friend Tasha?
No, this is me.
Are you going to do it?
Yeah, I'll do this part, yeah.
All right,
Great.
okay.
Okay, well, thank you, Michael. For those of you who don't know, my name is Josh Strootman. I've been involved with AIDS Walk for about 18 years now. So working with Michael behind the scenes for a number of years and helping produce the event along with our steering committee members, obviously our very dedicated board of directors. So Kimberly gave you all these reasons on why we're involved, why we're here tonight, and what we should be doing, what we can do to help eliminate stigma. One big way you can help that is by raising money for the AIDS Service Foundation. So we can distribute that money to the our AIDS service organizations that Michael mentioned earlier, and then also our community grant partners. So this is a just a little pie chart here that I wanted to show you, and it's really about an overall view of giving in the United States. It represents a breakdown of our charitable giving from a few years ago, so it's a couple of years old. And I don't want to go into great depth, but what I do want to point out is, though we might think that foundations, corporations are the major players in charitable giving, it's actually individuals. It's you, it's our team captains, our individual walkers, and those friends, family, and coworkers that give to you. As you can see here, annually, about 72% of overall charitable dollars in the United States are actually given by individuals. So really the heart of the fundraising and the advocacy through AIDS Walk is with you, our teams, and our individual walkers. However, we do love our corporate sponsors, and they do play a major part in our overall fundraising strategy for the foundation and for AIDS Walk. Corporations are crucial because they provide the underwriting expenses that it takes to put on an event. So it's not cheap to put on an AIDS Walk. You know, there's a lot of off-duty police officers, street closures, rentals and such that we need to actually produce the event, but these corporate dollars actually help underwrite all the expenses involved with the walk, so that when you're out there raising money on your AIDS Walk pages, through your teams, through your individual fundraisers, that money actually is going to go back to our AIDS service organizations and support them. So we love our corporate sponsors, and our corporate sponsors come through a number of different ways. Primarily, it's through people like you. It's through your corporations that you work for. It's through our volunteers from the AIDS Service Foundation board, from our board development chair, to our steering committee members, our event leadership. It really is how we bring in all the money through our corporate sponsors, and it's never too late to find a sponsor and for your organization that you work for to sign up. So if you have anyone that, if you think your employer, or you might know someone else that works for an employer that might be interested, please let Michael and I know. We still have some printing collateral that'll be going out. We still have all of our email marketing that'll continue to go out between now and the end of the fundraising season. So just let us know and we can help get them signed up. So some basics, principles of philanthropic giving. I have to give a shout out to our friend Bob Buchanan, who's now retired. He was what we call, Michael and I joked, the Dean of Fundraising in Kansas City. He taught over at UMKC and the Block School, and I can't remember the name of the course specifically, but essentially it was a master's program in fundraising, and that's what he taught. But Bob always told us that, that these are the major principles of giving. So people give to people. I give because Tasha Everhart asked me, and I love Tasha. She's a great woman. I love her so much. So I only give though unless they ask. So if Tasha doesn't ask me, I'm just not going to go out there and give to her. So she's actually got to send me out an email, send me a Facebook request, a LinkedIn message, a face-to-face request to make sure that I actually give. People give because they want to give. We all want to treat our friends well. We want to give to the greater good. We want to make a difference in the world. So people give because they want to give. They give to opportunities. AIDS Service Foundation is an opportunity, right? So we're making a huge difference here in Kansas City by raising these funds and by distributing them to our AIDS service organizations. So they give to these opportunities because they want to make a difference. They give to success. People don't want to give to a failing cause. They want to give to something that is actually, again, making a difference in the community, is successful, and has an impact. So they want to give to success. They give to make change for the good. In this case, we're giving to help eliminate stigma, to help our brothers, our sisters, our friends, anyone that's living with HIV or at risk of HIV in the community. We're giving to make change for the good. And then again, donors don't like uncertainty. They want to know that an organization is established, they have a strong board of directors, they adhere by their bylaws, they're doing what they need to be doing in the community to make a difference. So where are the dollars? The easiest and most effective way would be on aidswalkkc.org. So make sure that first thing you want to do before you start your team or start your individual page is to go out and register on aidswalkkc.org. If you've already participated in years past, it's really easy, it's quick. It's even easy if you haven't participated in the past. Online tools, Facebook fundraising is so easy. If you haven't done it yet, please try it out. The AIDS Service Foundation is the actual organization you want to be looking for. AIDS Service Foundation of Greater Kansas City. It's really easy to set up a birthday fundraiser. You can set up a birthday fundraiser for your dogs. You can set up a fundraiser for a party that you're doing. But definitely use social media and make sure you incorporate it into your fundraising strategy. Network for Good is the actual fundraising arm of Facebook. So whenever those charges show up on your credit card statement or in your friends and family's credit card statements, it'll be Network for Good. Individuals, again, asking your friends, family, and coworkers, social groups, whoever it is, to help make your successful fundraising efforts. Again, as I said earlier, it's 72% of the charitable dollars in the United States come from individuals. So make sure you do not forget to ask all of your friends, family, and coworkers. And then business contacts. So if you have a team and you want to, Tasha's going to talk about fundraisers here in a little bit, but you might have a team and you want to have a bingo or whatever it is. If you go to a restaurant on a regular basis or a hair salon, wherever it is, make sure you reach out to them and ask them to support your efforts because you support them. The more personal, the better. So obviously face-to-face is the best way to make your ask, but virtual is fine too. I know we're all busy now, especially with the COVID world, we can't get too close face-to-face, but make sure that you're making a personal request. It can be an email, it could be a LinkedIn message, it could be a Facebook message, but face-to-face is the best. More personal, the better. The Team AIDS Walk page, people love to be part of a larger group doing better for the community. So creating a team is your best way that you're going to raise the most funds for AIDS Walk. Obviously, if you're going to have a teams page, you need to have your personal AIDS Walk page also. And again, Facebook and other social media, be sure to utilize it. Tasha could talk more about that later. And share your story. Why are you walking? Tell us why you're walking. Randy gave us a great testimonial at the beginning of this workshop, but be sure to tell your story because people want to know why you're involved with this organization. And then always keep your eyes open for opportunities. I know Angela and Ryan and Jeff Cannon are very active out there looking for opportunities for us to raise money in the community. We're looking at doing happy hours at different places. They can be a fundraiser at Stuff in Brookside, whatever it is, but keep your eyes open for opportunities for you to raise more money. As far as steps for asking, know the case for AIDS Walk. Know where the money goes. Know what the AIDS Service Foundation's mission is. Know who the beneficiaries are. Know who some of the leadership members are. Who are some of the people that you might know that's on the board of the directors. Who do you know that's maybe on the steering committee or a co-chair for AIDS Walk? But make sure you know the case. Know these stats that, not all of them, but know some of the stats that Kimberly shared with us tonight. You know, if you just maybe have your elevator speech lined up with maybe 2 or 3 of those stats, I mean, I really will help you increase your chance of hitting your fundraising goal. Make your own gift first is like one of the most important things. There have been a number of times I've done Facebook fundraisers on for like my birthday and such, and more often than not, your gifts will almost match exactly what you gave. So if you want to make your own gift first, if you're if you actually have the capability to do it at the time, please do it, because it really does help. Don't forget to ask for the gift. You just can't go out to the aidswalkkc.org website and create a page and just expect people to give to you. You got to make sure you actually send the gift request out, and then make sure you thank your donor and report results. Nancy Harrington, who has been on these for a number of years, she's down in Florida now, retired, but she done this great. She had a great strategy where she would, at the beginning of her fundraising campaign, she would say, okay, this is email 1 of 4. I'm not going to bombard you with emails every week, not every day, but I'm going to give you 1 of 4 emails, and I'm going to give you a status update on where we're at the time that I send that email. And then at the end, she would always make sure that she would send out an email thanking all the donors and then giving them a fundraising update, and then also an overall fundraising update for the walk. So make sure you thank your donors. Okay, now I'm going to hand it over to Tasha Everhart, who is one of 4 AIDS Walk co-chairs for this year. And I think, Tasha, is this maybe your 3rd year being co-chair?
I think so. I feel like it's kind of been a blur, but I think it is.
Yeah, so Tasha's going to help lead us through some fundraising ideas.
So hi, good evening, everybody. Josh gave a couple of really good starters or kind of segues into this. First, of course, is creating an online fundraising page. The easiest route is going to be that Facebook, so that Network for Good on Facebook. It's one of the easiest user-friendly avenues that you can do. But in that, if you're not looking to just basically ask on Facebook, work fundraisers go really well. If you are a corporate or it's business casual, Jeans Day, Casual Day always generates a lot. I know a couple people here who work at more, I work at a very casual place, so it's different for me, but a lot of people actually have to, like wear suits and stuff. I guess that's a thing. But Jeans Day, after work competitions, floor competitions, virtual events, I'm going to put in-person events as well. Bingo, trivia. Also I know one of our virtual bingo events was super fun. Somebody was getting their hair shaved. I won't call out any names, but more money got thrown out there when we heard if we made a certain amount of money, someone would shave their head. So doing fun little things like that impromptu after you've already created a little buzz about that event, doing something, an audible in the middle of it drew a lot more fundraising than they had imagined. Of course, pet-related events will always bring anybody out. I know there was a really big event at Bar K. They also work with us pretty nicely if you are looking to host those, so they're very easy to work with. And pre-walk parties. So that could be a corporate after-work party, neighborhood parties, wine and cupcake parties. I've never been to a wine and cupcake party, but if any of you have them, please invite me, because easily 2 of my most favorite items. An extravagant dinner party. Also, we've done a murder mystery party that was super fun, themed, and also fundraising. Another random, but it was so much fun to do. Musical events, cabarets, other theatrical productions, or an in-person or virtual happy hour, whichever is your comfort level, is also kind of that pre-walk party. And no matter what, make personalized thank yous. Even just a blanket thank you, of course, is thoughtful and nice, but even just some sort of little tiny putting their name on a pre-printed thank you card makes all the difference, because that just shows that person you took 2 extra seconds to write their name. But baked items wrapped with a red ribbon and a big thank you. update emails with amount goals raised and desired goals, just keeping people aware of what you're doing and what kind of strides you're making makes people feel involved. Pictures on social media showing everyone having a good time. Also thanking people on social media. So I know when you make the donations on Facebook, it tells you, like Josh said, he of course would donate for me and I will be donating for him because it is Josh's birthday and he's asked that of us. But you can go in and say thank you right then and there when that person makes the donation. And then thank you cards with red ribbons, anything that just ties you back into the AIDS walk. And I think that's me.
That's it. Michael?
Okay, yeah. Well, thank you, Tasha. We are here to serve you all that are raising money and building teams out there. And we ask that you call us, email us, text us, whatever it is. If you need our help and support and just even to go over some ideas that you're thinking about, please don't hesitate to write that email or pick up the phone and call us. We have all sorts of things that we can help you here with. They're listed here. We've got flowers that we can help you with raffle tickets and money jars. And we can help with some gifts and prizes, some bingo calling set, which if you have a bingo party and you need to borrow the AIDS Walk set, please let us know and we'll work out a way to get them to you. Of course, we have pledge forms and posters. A lot of that is available on the website. We'll be more than happy to work with you on looking to your company or another company that you might be, you might have friends there that work there that you want to get a corporate gift or a matching gift in many cases. And as we have here, AIDS Walk branded prizes, we have lots of things that we can help you as incentive gifts at your party. So there's our phone number and there's our email. So please don't hesitate and call me or I know that Ryan and Kimberly and Angela, yes, they all work full-time other jobs, but we're all here to help you whenever that you need the help. And I'm around all the time. So, all right. I think I wanted to say one more thing. Next Thursday night, and we'll put out an email blast on this, but we wanted to announce it this evening. We're going to have a gathering at 5:30 p.m. at Gale's, which is located at 5424 Troost. It's a restaurant and bar. It's going to be an evening of fun and not a bunch of talking heads. In fact, we met with one of our celebrated co-hosts, Ron McGee, last night and came up. I think he's going to have a lot of fun. And it is to bring our team captains and our steering committee together and just to have a really good celebration kicking off our 2022 AIDS Walk season. So again, we'll get something out on that email blast real soon and hope you will join and bring your friends or come by yourself and make new friends. So I wanted to say that. And I was going to say, but everybody's been wishing Josh happy birthday, but what's one more? So happy birthday, Josh.
Thank you.
I think we're towards our last. Do we have one more slide here?
This is it.
Okay. I on mine, I have volunteers and we just thank everybody. And we thank all the team captains and all the workers out there raising the money for us. And I know that Ryan and the board join me and Josh in saying thank you for all the work that you all have already done and are continuing to do and for coming tonight. And we'll look forward, I hope to seeing you next Thursday evening, 5:30 for fun kickoff. And with that, is it Ryan or Anybody from the board want to add anything? Josh?
No, I mean, if no one has anything to add, maybe ask, if anybody has any
Questions?
questions.
Yeah.
Or, yeah.
We are open for questions. It's a lot of information to be given, so don't be shy. All right. Going once, going twice.
But there was another slide, sorry.
There that volunteer thank you is. So anyhow, once again, thank you, thank you. And I'll stay on for a little bit, for a couple of minutes if anybody wants to stay and chat or ask any questions one-on-one.
I'm going to stop recording.